I'm Norman Scott, based in New York City at the Insel Scott Kelly Institute. I really don't know why I decided to go into medicine. I always wanted to go into medicine as a child. My family was not in medicine, except I had a great aunt who graduated from medical school in 1913. And that was the only familial relationship we had to medicine. I always wanted to do it. I always wanted to be a surgeon, and in medical school I got interested in orthopedics. Well, when I did my residency, orthopedic residency at the Hospital for Special Surgery in New York, I had the opportunity to be there when knee replacements were just developing. They were embryonic stage, as was, quite frankly, sports medicine and knee surgery. That became my interest in both of those areas, and initially started off in knee arthroplasty, and have continued that to this day, and then got involved with taking care of sports teams. I took care of the New York Knicks for 27 years, Rangers for about 8 years, the Liberty for about another 10 years. So all in all, is about 44 seasons in 27 years. So my entire interest focused just on the knee, both arthroplasty and arthroscopic ligament procedures. The first book, Surgery of the Knee, was written by Dr. Insel primarily by himself in 1984, I believe. That was his first edition. I had published a book in the early 90s called The Knee by myself, and we came together as a group, as I mentioned, the Insel Scott Kelly Institute, and we decided to merge our efforts and just do one textbook. So over these ensuing years, we're now at our 5th edition. Basically, things that we've done that are a little bit more up to date, so to speak, are quarterly updates. We have online quarterly updates that will talk about the newest current concepts in whether it be sports knee or adult reconstruction knee or pediatric knee, and this will allow readers who purchase this book to just go into their internet and to stay up to date. We're taking the leading experts in these areas to give basically symposium presentations and updates. We have, we believe, the largest collection of videos in this textbook, 150 or more, ranging from anatomy to surgical technique, physical examinations, which we think appeals to a broad spectrum of paraprofessionals as well as orthopedic surgeons who are interested in the knee. We're really at a turning point in generation. My generation certainly would still rather go back to textbooks, although we realize the value, and it is incredible now to see everything in video. So it's definitely progress, and it's in the right direction. I suspect in the future we'll be doing 3D anatomy, 3D surgery in the 6th edition. So I think that progression is only for the benefit of all those who wish to, really be students of the knee and to gain knowledge. The one thing that's important is that this book has an international flavor. This is not just a one country, one continent approach. We have contributors from all over the world, and we think that's very important because there are a lot of ways to approach various knee conditions, and having everyone's input only sort of brings us more to a consensus that is eventually going to work for the patient.